Welcome to the Aspen Cervical Orthosis. This is used for patients with forward head posture, loss of cervical lordosis, as well as radiculopathy in the hands. This is very easy for the patient to wear, so it makes them more compliant in using it. Let's go over how to fit a patient. There are 3 adjustments for the cervical orthosis. Let's go over those. The first adjustment is the adjustment for the size. This is the side that you'll be using. Once you adjust it to the patient then has their easy side to take it off and put it on. How you size the patient? Put it around their neck. Simply undo the Velcro till it's snug. There are many features to the cervical orthosis. Let's take a look inside. Inside, you have a hot and cold pack. This can be put in the refrigerator or microwaved for heat or cold. Behind there is a bladder. This is similar to what you've seen with a posture pump. And this is going to go against the patient's cervical area to help support and correct the posture. Now, when fitting the patient for the cervical orthosis, make sure on the chin strap area that you keep these areas out. We want to make sure that there's a nice snug fit in the neck. Make sure his chin fits into the chin carriage. You're going to Velcro their side in and make your adjustments here to size the patient. This is the front of the device where the chin carriage is. How this is adjusted is simply pull the lever in the front out and you simply turn it. This adjusts the chin carriage up and down for the patient's comfort. We will show you what that looks like on a patient. You want the patient's chin to be parallel with the floor. You simply pull out the center plug and you turn it up and you can feel it click. Once you get the desired area, you push it in to lock it. As you can see, it also helps create the perfect posture for the patient's neck. This is the back of the device. These are the occipital pads that allow for traction. This device moves up and down, and we will show you on a patient what that looks like. For the occipital adjustment, you simply unlock it and you move this up to whatever point is most comfortable for the patient. Again, this is to support the occiput. Number 2 is usually the best setting. Then you simply lock it. Once you've made all 3 adjustments, the patient's chin will be parallel to the floor and the pads will be supporting the upper part of the neck. This is going to create the perfect posture for your patient. With the bladder that's included, this is going to help also create distraction so that it can help your patients who have radiculopathy into their hands. They simply grab the bladder and squeeze, and that blows the bladder up till it's a nice fit. To release the bladder, there's simply a button to push and that releases it. As you can see, after all the adjustments are made, this is very easy for the patient to use at home. The patient should use it no longer than an hour a day. You should start off with the patient using it 20 minutes once a day.